glad that you guys are sharing the story, what happened to Megan with her foot, that she suffered with complex regional pain syndrome, and you want to give a message to everybody that how it can be helped. So we're very glad to be treating you at Vital Energy, and I'm Hima Dalal. You want to start with her story?
Megan was an active varsity volleyball player, and the beginning of September she was playing in a volleyball tournament in Sumter and complained of her foot. And we've had inserts since 8th grade dealing with a knee injury, so we thought just maybe it was something with that. Maybe her inserts needed to be changed. And so then it got worse by the end of September, and her foot was in a lot of pain. So we took her to a black and blue clinic with an orthopedist, and they couldn't figure out what it was, and they put a foot in the boot, and it ended up causing her foot a week later to be immobile. She could not will it to move. She couldn't do anything with it. She had total feeling in it, but she couldn't get it to move. So for the month of October, we spent multiple times trying to figure out what was going on until we went to another doctor, a neurologist, who diagnosed her with complex regional pain. The therapy was to go to physical therapy 5 days a week, outpatient. So we did that for 3 months, maybe even 4. 5, and they ended up getting her foot to move, but it still wanted to pronate inward or have the foot drop. And then the pain, they really couldn't do much for the pain. So they got her walking again, but they couldn't deal with that. So in February, we tried multiple things. We ended up going to a sports med doctor who prescribed an AFO, which is a brace to help her learn to walk properly, and a foot drop boot for the nighttime. And she was on multiple medications for pain and for just various things dealing with the disease. And she ended up, we were going to go get a nerve block because the pain was so excruciating. And it just so happens that I went to my physician, who recommended that we try something different. And the neurologist also told us to think outside the box, that it was time. And so they recommended that we come and get a consult with Vital Energy. And so that was our stopgap before we went to the nerve block. And so we ended up coming here in March, and she started various therapies, the cranial-facial,
Craniosacral therapy.
and she did the acupressure. She couldn't do acupuncture. We learned that the hard way. And the Reiki treatments, the aquatherapy, and I'm sure there's some more that I don't know about, but the various treatments helped her reduce the pain. She has reduced her medication drastically. She was on Lyrica at that time and is totally off that drug. And then we're in the process of reducing the other ones. She's able to understand her body better and not just be tensed up when she has the pain. She understands more and more, I think, every day how to deal with the pain and to push through it and not let it control her, which is with this disease something that we need to have. And we have more good days than we have bad days. So it's definitely, we feel like something that's under control. If not, can be, I don't want to say the word cure, but it can be managed quite well.
In my opinion, it can be cured, and that's what we are aiming towards. And my promise has been to Megan that from complete foot drop with no movement in that foot, she'll be in the high heels. And we have progressed all the way up to a normal shoes now. So that's where we are heading towards. Now in the process, what I really enjoyed working with Megan, and I would say that what really helped is the family support, home exercise program, and she faithfully tried everything what we told her. If it was hurting or not hurting, she really cooperated, and that really helped. What really helped me to work with her was muscle energy treatment that we did, and there was various muscle energy treatment. We did acupressure points using a crystal therapy. We did Reiki. We did cereal healing treatments, different healing treatments. What it did it awakened her nerve, decreased the pain, and we did myofascial release on top of it. Craniosacral therapy helped you with your thermostatic changes, so the hot flashes and the burning sensation and the heat with the temperature change that came, and the redness and blotching and hypersensitivity decreased with the craniosacral therapy. I was able to progress you to the HydroWorks treatment in the pool to get you stronger with the walking, and that really helped a lot. Underwater treadmill, the heat of the water, the buoyancy of the water took the pressure off, and we progressed now to the lead therapy, which is very good. And for her, the sports-specific training that we are going to start next week will be more plyometrics against the jets. So the goal is to take you back to completely training volleyball. And some experience we had, right? Tell me about the last week when you had to go to the school for the school function, the award ceremony. How?
We had a graduation for our school, and I'm in the top 10%. So I had to go help with graduation, and I had to wear shoes. But since my feet are sensitive, we spent about like 3 hours finding a good pair of shoes, which is harder than you would think. And I was able, with slight pain, but I was able to walk around and stand and hand out diplomas with normal shoes on, which is awesome because I wouldn't be able to do that before coming here.
So that's really taking you towards normalcy.
Yes.
And we're very proud of your progress, and I'm thankful that you were able to come to Vital Energy.
So
And so the message that you would give to anybody suffering from after the post-sports injury or with the complex regional pain syndrome would be?
I think really just to keep an open mind, and that's key, but definitely coming here with an open mind is that it doesn't have to be pills or normal therapy. It helps, and you have to realize that your body's not the same as everyone else's, but in the end it can be fixed and it can get better. You just have to realize that people can help.
And complementary therapy in a rehab has been a blessing to progress people with complex pain issues, and you're off most of your medicine, and you're going to be off completely with the medicine. So that's very good. Thank you.